Welcome to Peds Doc Talk TV. I'm Dr. Mona Amin, a board-certified pediatrician and mom, and we're talking all about mouth injuries on this video. Prevention, what to do in the moment, what to monitor, when to seek an evaluation from a pediatric dentist or your pediatrician, and so much more. Before we continue, make sure you hit that subscribe button because that's how you stay up to date on all of the videos I put out here on Peds Doc Talk TV, and follow me at Peds Doc Talk on Instagram. And here we go. So I released 2 episodes today. This one is about mouth injuries, and I also released one about head injuries. So make sure you watch both because when your child's injured, you want to make sure you know what to do in both of these situations. So in terms of prevention, make sure you child-proof your home. I usually recommend child-proofing when your child is crawling or even before that, because you want to make sure by the time they're starting to pull to stand and take steps that you have sharp edges taken care of. Now remember, prevention doesn't mean that accidents can't still happen, but we're trying to reduce risk as much as possible. A lot of mouth injuries can also happen with a child running around with something in their mouth. For example, a pencil. We've seen this where a child's running with a pencil and falls, and then the pencil injures their palate in their mouth. So it's important to use what we call the toilet roll test, which one of my friends at Safe Beginnings on Instagram shared with me. So with the toilet roll test, if an item can pass through the toilet roll, then it's not safe for a child to be playing with unattended. Why does this matter? Well, it doesn't look like it's going to cause harm. Well, if the child puts this in their mouth, this is basically the size of the child's mouth, and they're running with it and they fall, it could injure their top of their palate, teeth, gums. So we want to make sure that you understand that this test can say, hey, if my child is playing with an item that's smaller than this and it can fit through, they need to be attended at all times, and they really shouldn't be running around with that item as much as you're able to protect that from happening. And remember, accidents happen. We can't be on top of our children 24/7 to make sure that they don't get injured, but what we can do is reduce risk. So if your child does have an injury, I'm asking you not to blame yourself. Try your best in understanding that you did all you could, and for the future we do the best we can to remedy that situation so it doesn't happen again. The first step is I need you as a caregiver to take a breath. When your child injures themselves, it's going to be very traumatizing for them and for us. I mentioned this in my head injury video also. My son Ryan injured his mouth about a month and a half ago on the side of a bar stool. He was playing, he was trying to reach for something, and he fell and he hit his mouth on the bar stool. Blood was everywhere, and I'm going to go over what I need you to do in the moment. But let me tell you, it was traumatizing for him, and it was extremely hard for me to see, even as a pediatrician. Yes, I knew what to do in the situation, but it doesn't take away the fact that it was hard to watch. But my goal by the end of this video is that you will feel so much more confident on what to do in those moments so that you know how to stop the bleeding if there is bleeding, and what to monitor, and if your child needs to be evaluated. So after you've calmed yourself and just taken that breath, you need to assess your child. If your child is crying, we know that they are conscious, so then you can proceed with the steps that I'm mentioning. If they have any loss of consciousness, you need to get them evaluated and go through what I mentioned in the head injury video. So now, just say you assess your child and you notice bleeding from the mouth. The first step we have to do is stop that bleeding. And the mouth is a very vascular area, so it is going to bleed, and sometimes it's going to bleed a lot. Sometimes you're going to feel like it's not going to end. I need you to hold pressure where you think that blood is coming as long as you're able to. This is vital. Sometimes we're able to see that blood stop within 5 to 7 minutes. If you are holding pressure and that child's bleeding is not stopping, you need to seek an evaluation from a pediatric dentist or a pediatrician, and I'll mention later who I recommend in these situations. So get a clean paper towel or a clean washcloth or something clean that you can put in their mouth to hold pressure. They are going to cry. We have to attend to them and help them. So I want you to make sure you understand and verbalize what you're doing with your child the entire time. When it happened with Ryan, he was not happy, but he was not happy from the entire injury. But I had to stop the bleeding. The entire time I said, Ryan, I know this is very hard. I'm going to help you. We're going to make you better. So remember that even in times of chaos, you can be the one to just verbalize. And the reason why I recommend verbalization in these situations, it can help bring calm to you. The fact that you're narrating what you're you're doing to your child can also help you go through your mental checklist. So narrate, narrate, narrate. It can really help, and also understand what you're looking for. If the bleeding hasn't stopped in 7 minutes, you would want to go to your child's clinician's office, a pediatrician's office. If they're closed, you could go to an urgent care or an ER to see and assess what's going on with the bleeding. So if your child is still bleeding and you go to get them evaluated, they're going to be looking at the various structures in the mouth to see where the bleeding may be coming from. If you're at home and that bleeding is stopped and you're able to, it's great to kind of take a look to see if you're noticing anything in the structures in the mouth that may need evaluation. The first thing you're looking at is the tongue. So in the tongue, you're noticing, are there any open cuts, any lacerations there? If there are, you want to make sure that you speak to your child's clinician if they're continuously bleeding. If it's minor and stop bleeding, you can monitor it. These rarely need closure, but of course, if it's continuously bleeding over 7 minutes, we want to evaluate that child to make sure they don't need anything else done for their tongue. In terms of the upper lip and lower lip, so your frenulum. So with injuries, you may see that those frenulum get lacerated, so broken. So with the upper frenulum, these don't need repair. For these, you want to make sure you're holding pressure. These can bleed for quite some time, like I said, 5 to 7 minutes, and then you want to assess. If you pull back the lip of your child after they've had a frenulum injury, it can cause it to rebleed. So you want to monitor, but you want to avoid continuously checking the lip. You're just monitoring every so often to make sure is there active bleeding that you're noticing. So in terms of the lower lip, same things. If it's continuously bleeding, you want your child to be evaluated. But do remember that if you pull the lip up or down after an injury of those frenulum, it can rebleed. So no need to compulsively check it unless directed by your child's clinician or dentist. In terms of injuries to the roof of the mouth, if, for example, your child was running with a pencil and suffered an injury, it's important that if you notice any visible injury to the roof of the mouth that you get that evaluated. If you're not sure, you go to get them evaluated as soon as possible. In terms of the teeth, if anything is cracked, crooked, or displaced, you see the pediatric dentist. If you have a knocked out tooth, you want to see the dentist as well. For a permanent tooth, you want to try to find the tooth and place it in a tooth-saving solution. I'm showing some pictures here on what that might look like. If you don't have that, you can put it in milk and see the dentist as soon as possible. This is typically a dental emergency if you lose a permanent tooth. So if your child's dentist is not open, you want to go to the ER where dental services may be available. This is why having a dentist is so important. People are like, well, I'll wait till 2 or 3. I think dentists provide so much value, obviously, but it's great to have a dental home in case of emergencies. Just say there were no cracks in the teeth, crooked teeth, or teeth that was knocked out. Your dentist may have you monitor for a few things. They'll have you monitor for color change of the tooth. So noted here, if there are color changes, you would want to let your dentist know, or they're going to want you to look out for abscesses. Abscesses are not always recognizable right away. They can develop months or years later. So it's important that if you see this in the gum line of your child's mouth, that you get it evaluated. In terms of management at home, after you've done your surveillance, you want to make sure you put cold items in their mouth. So whether that's an ice pack, whether that's a popsicle, to alleviate any swelling. Sometimes those upper lips can get very swollen from the impact. So ice is vital. Popsicles are great. Popsicles are doing 2 purposes. It keeps the child hydrated, and it also can provide some comfort because of the cold. You can also use weight-appropriate pain meds like acetaminophen or ibuprofen for pain management. But if your child is very inconsolable and pain meds are not helping, you want to get them evaluated. Personally, I also advise a lot of my families after mouth injuries to temporarily avoid anything sour, spicy, citrusy, because these things can actually aggravate our mouths if we have an abrasion or a laceration or anything like that. So just for the time being, once you see that they're healing and looking better, you can start to introduce those spicy or acidic foods back into their diet. So now, in terms of a mouth injury, do you go to your child's dentist or your child's clinician? In my opinion, I think you should go to your child's dentist. Why? Is that if there's any injury of the teeth, any injury of the gum line, if you come to us as your child's clinician, we are going to say, follow up with your dentist. So if you have the option, go to the pediatric dentist first. Now, if you do not have a pediatric dentist, I want to reassure you that we are capable of managing this as well. But we know that if there are any injuries that need to be monitored, we're going to be sending you there anyways. So yes, as a reminder, it's important to create a dental home. This means after the age of 1, find a dentist so that you have them for regular checkups and in case of emergencies like this. So if your child has an injury, you have someone to monitor that injury. So here is a summary of what I need you to look out for in the case of a mouth injury. An infection concern, so swelling, pus that you're noticing from the mouth or any area around the mouth with or without fever. They can't open or close their mouth. They're having trouble swallowing fluids or saliva. Remember, sometimes they may not swallow food, but they need to be hydrated. And if you're noticing that they're not hydrated, you need to seek an evaluation. Severe pain, like I mentioned, so your medicine like ibuprofen or acetaminophen are not helping. A gaping or open wound on the lip, around the mouth, inside the mouth. If you notice any open, wide, gaping wound, you need to get that evaluated. Injury to the back of the throat. Bleeding won't stop after 7 minutes. Any trouble breathing, or if you are concerned about your child. Remember that with any injury, you are the most important historian. If you are concerned and don't like how your child's looking, we want to evaluate your child. Thank you for joining me. Make sure you watch my head injuries video that I released today as well. As always, hit that thumbs up sign, comment below, subscribe to Peds Doc Talk TV to support me and this channel, and I'll see you next week.